Have you ever wondered how sounds make their way from the source all the way to your brain? Take a trumpet, for instance. When it's played, it makes sound waves in the air. The outer ear catches the waves, which then travel through a narrow passageway called the ear canal. The sound waves reach the eardrum, which is a membrane roughly half the size of a dime. They make the eardrum vibrate, which in turn vibrates 3 tiny bones called the malleus, incus, and stapes. These bones amplify or increase the sound vibrations and send them to the cochlea. The cochlea is shaped like a snail and is the size of a garden pea. It is filled with fluid, and the sound vibrations make this fluid ripple, which creates waves. Hair-like structures called stereocilia sit on top of hair cells and are grouped together as hair cell bundles inside the cochlea. The hair cells inside the cochlea ride these waves, and the hair bundles are moved. The hair bundle on top of the hair cell turns these movements into electrical signals. As the hair bundles are moved, ions rush into the top of the hair cells, causing the release of chemicals at the bottom of the hair cells. The chemicals bind to the auditory nerve cells and create an electrical signal, which travels along the auditory nerve to the brain. Different hair cells respond to different frequencies of sound. The hair cells at the base of the cochlea detect higher-pitched sounds, such as a piccolo or flute. The hair cells toward the top of the spiral detect progressively lower-pitched sounds, such as a trumpet or trombone. At the very top or apex of the spiral, the hair cells detect the lowest-pitched sounds, such as a tuba. The auditory nerve carries the electrical signal to the brain, which interprets the messages as sounds that we recognize and understand.
As just explained, the process needed to hear is complex and can be interrupted at any point during this process. When you are overexposed to noise, the hair cells in your ear become overstimulated, and once the hair cells are overstimulated, they become paralyzed and stop responding to sound. After a period of quiet, your hair cells will recover. However, repeated exposure to excessive noise over time will kill these hair cells and they lose their ability to recover. This can result in permanent noise-induced hearing loss. The major deterioration of hearing occurs during the first 5 to 10 years of employment in a noise-risk environment. As you can see, the hair cells of the cochlea on the left are of a person with normal hearing, and the one on the right shows the permanent damage overexposure to noise can cause. If we use our earlier example of seagrass moving with the action of waves in the ocean, we can demonstrate the impact of excessive noise on the cochlear hair cells. Initially, when large waves move over the seagrass bends with the waves, but recovers its position once the wave has passed. After repeated exposure to large waves, the attachments of the seagrass weaken and eventually the seagrass will break off. This is exactly what happens to the hair cells in your ear with repeated exposure to loud noise.
In our inner ear, we have a lot of tiny hair cells that move and pick up the sounds that we hear. The movements are then converted into signals that are sent to our brain. Sensorineural hearing loss results from damage to or reduction of the number of tiny hair cells in the inner ear. One of the causes is aging. We all lose some of the tiny hair cells in the inner ear as we age. Another major cause is noise. Noise can damage the hair cells in the inner ear. Diseases such as mumps, meningitis, and Meniere's disease can result in a sensorineural hearing loss. Certain drugs like aspirin, cisplatin, quinine, and some antibiotics as well as certain types of chemotherapy can also cause a sensorineural hearing loss. Sensorineural hearing loss can be inherited, and finally you may lose your hearing ability due to head or ear injuries. A sensorineural hearing loss cannot be cured, but people with a sensorineural hearing loss may benefit from the use of hearing aids. You can find out more about sensorineural hearing loss on the world's leading website on hearing and hearing loss, hearit.org.
Mixed hearing loss is a combination of conductive and sensorineural hearing loss, which means there is damage in both the middle ear and inner ear. In a healthy ear, sound travels through the ear canal, where it is then processed by the inner ear and sent to the brain. Mixed hearing loss occurs when the middle and inner ear are unable to process or send sound vibrations to the brain. For people with mixed hearing loss, sounds can be both softer in volume and more difficult to understand. Depending on the degree and makeup of mixed hearing loss, it may be treated with medications, surgery, hearing aids, or an implantable bone conduction hearing system.
Within the cochlea, small hair cells stimulate the hearing nerve which carries the signal to a specific location within the brain called the auditory cortex. However, in about 7% of patients with significant hearing loss on one side compared to the other, a non-cancerous and slow-growing tumor develops on the main nerve leading from the inner ear to the brain. Known as an acoustic neuroma or vestibular schwannoma, pressure from the tumor on the nerve itself leads to an initial progressive hearing loss. As the tumor gets larger, causing greater nerve compression and/or stretching, it may cause tinnitus, dizziness, and eventually even facial paralysis. Acoustic neuroma usually arises from the Schwann cells covering the nerve and grows slowly, averaging about 1 mm increase in size per year. Treatments for acoustic neuroma include regular monitoring, radiation, and surgical removal.
Hearing aids are small electronic devices that amplify sound. While they can't restore normal hearing, hearing aids can help you hear better by making certain sounds louder in both quiet and noisy situations. Hearing aids come in several styles that fit in or on your ear in different ways, including behind the ear, in the canal, and completely in the canal. While the style may vary, all hearing aids have the same basic parts: a microphone, amplifier, speaker, and battery. Here's how they work. First, the microphone picks up sounds from the environment. Then a computer chip with an amplifier converts the sound waves into electrical signals. It analyzes and adjusts the sounds based on your hearing loss and the level of other sounds around you. These amplified signals are then converted back into sound waves and delivered to your ear through the speaker. In this way, hearing aids can improve your hearing and speech comprehension if your hearing loss is caused by damage to the sensory cells in your inner ear. The greater the damage to these cells, the more severe your hearing loss will be, and the more amplification you will need from a hearing aid in order to compensate. If you think you might have hearing loss, talk to your doctor.
Cochlear implant is a specialized hearing device to restore hearing to patients who have severe to profound hearing loss. The procedure begins by performing a mastoidectomy accomplished by removing the hollow bone behind the ear. After making an incision and retracting the ear forward to expose the mastoid bone surface, the honeycomb partitions of the mastoid bone are then drilled away down to where it connects into the middle ear. There are important structures that are preserved during this procedure, including semicircular canals responsible for inner ear balance, the bone that separates the brain from the mastoid cavity, the sigmoid sinus, which is a large blood vessel, chorda tympani nerve, which supplies sense of taste to the tongue, the facial nerve, which is responsible for facial movements. Once the round window is exposed, a well along with a channel are drilled into the skull upon which the implant is seated. The electrode array is then inserted into the round window and gently threaded into the cochlea. The skin incision is then closed. After the incision has healed, the external component of the cochlear implant can be worn to start the process of hearing restoration.